Assalamualaikum and a very good day to Madam Fazliana. My name is Wan Nordina Atira binti Rosli and I am from BMI 18B. Today, I will be presenting on the topic Method of Limiting Occupational Exposure, which is part of the BMI 4113 Radionuclide Imaging Module. This presentation will begin with a brief introduction to radionuclide imaging, followed by overview of the types of radiation involved and the potential risks faced by healthcare workers. From there, I will discuss the importance of radiation safety training and then move into the core focus of this presentation, the various strategy and protective measures used to minimize occupational radiation exposure in nuclear medicine. With that, I would like to begin the presentation. Radionuclide imaging is a specialized medical imaging technique that utilizes small quantities of radioactive substance known as radiotracer to diagnose and evaluate various diseases. This modality is widely applied in nuclear medicine because it provides functional information about organs, something that conventional imaging modalities cannot offer. In clinical practice, radiotracers are either injected or ingested by the patient. Once administered, they emit gamma radiation, which is captured by highly sensitive camera such as gamma camera, SPECT, or PET system. The image produced reflect physiological activity within organ and tissue, allow clinical to detect abnormality at early stage. Overall, radionuclide imaging plays a critical role in modern diagnostic medicine due to its ability to assess organ function in non-invasive and highly accurate manner. In radionuclide imaging, several types of radiation may be encountered, each with its own characteristic and safety consideration. First is gamma radiation, which is gamma radiation is the primary form used in nuclear medicine. Gamma rays are highly penetrate and can travel significant distance through the body and surrounding material. Because of this, effective shielding is essential to minimize occupational exposure. Second, thermal radiation is generally not a major concern in clinical imaging. However, it may become relevant in situations where radioactive particles are inhaled or ingested due to poor handling practice. Such internal exposure poses long-term health risks. Lastly, beta radiation is less penetrate compared to gamma radiation but can still pose hazard, especially during handling of certain radiopharmaceuticals. Without proper protection, beta emitters can cause localized tissue damage. Understanding the characteristic of each radiation type is essential for implementing appropriate protective strategy in the workplace. Radiation exposure in nuclear medicine carry potential risks that can be categorized into acute and chronic effect. For acute exposure, extremely high dose delivered over short period can lead to radiation sickness. Symptoms such as vomiting, nausea, dizziness, and severe fatigue may occur. Although rare in clinical setting, this risk exists during accidental contamination or significant procedural error. Chronic exposure, on the other hand, result from repeated low-dose exposure accumulate over long period. This can cause long-term biological effects, including genetic mutation, which may impact future generations. This risk emphasizes the importance of comprehensive radiation protection, not only to safeguard worker health but also to ensure compliance with regulatory and international safety standards. Radiation safety training is fundamental component in ensuring safe practice within nuclear medicine department. Training equips workers with an understanding of radiation risk and teach them proper technique for handling and disposing of radioactive material safely. Effective training also supports skill development, enabling workers to operate protective equipment, monitoring device, and radiation instrument with confidence and precision. Furthermore, ongoing training ensure that all staff remain compliant with established safety guidelines issued by authoritative organizations such as International Commission on Radiological Protection (ICRP), and most importantly, proper training prepare workers to respond efficiently during radiation emergency, thereby reduce severity and consequence of any exposure incidents. Okay, occupational exposure in nuclear medicine primarily arise from routine clinical and laboratory activities. One of the major contributors is the handling and preparation of radiopharmaceutical in hot lab, where workers are often in close contact with unshielded radioactive source during measurement, dispensing, and quality checking. Another important source of exposure is administering radiopharmaceutical injection. This procedure typically involves direct handling of shrink contain high activity level, increasing external dose to the hand and upper body. Additionally, once a tracer is administered, the patient themselves become temporary radiation source. Prolonged close contact during positioning, imaging, or patient assistance can contribute to cumulative exposure. Exposure may also result from working around imaging equipment such as PET system, which operate with higher photon energy. Finally, accidental contamination events, including spill or improper waste handling, can significantly increase internal and external exposure risk. Understanding this exposure pathway is essential before applying effective reduction strategy. The fundamental principle of radiation protection as recommended by ICRP revolve around three key elements: time, distance, and shielding. Firstly, reducing exposure time directly reduces total absorbed dose. This emphasizes the importance of efficient workflow preparation and minimize unnecessary handling of radioactive material. Second, maintain adequate distance is critical. Radiation intensity decreases exponentially with distance due to inverse square law. Even small increases in separation can significantly reduce exposure, especially during patient interaction or tracer administration. Third, shielding represents the use of physical barriers such as lead glass screen, air block shield, shrink shield, tungsten container to attenuate radiation before it reaches the worker. These three principles form the foundation of all radiation safety practice and must be consistently applied in both clinical and laboratory settings. Personal protective measures complement engineering and administrative controls by reducing individual risk. All personnel are required to wear dosimetric monitoring devices such as TLD and OSL badges to track cumulative exposure and ensure regulatory compliance. In addition, glove, lab coat, and eye protection reduce the likelihood of contamination during the handling of radiopharmaceutical. Good hygiene practices are essential, particularly avoiding hand-to-face contact and performing frequent hand washing, especially after handling radioactive shrink or working in the hot lab. Although personal protective equipment does not eliminate exposure entirely, it significantly reduces the probability of contamination and enhance overall safety. Safe work practice are behavioral measures that ensure radiation exposure remain as low as reasonable achievable. Adherence to standard operating procedure is the fundamental to maintain uniform and safe practice across all staff members. Using shielded equipment, preparing material in advance, and organizing the workspace efficiently helps minimize both handling time and proximity to radiation source. Staff should also limit unnecessary contact with radioactive patient, especially immediately after administration when their radiation level are highest. Proper and consistent handling of radioactive waste further prevent accidental contamination or unnecessary exposure. This practice, when consistently followed, creates strong safety culture within the department. Administrative controls involve organizational policy designed to limit individual exposure. This include staff rotation, which prevent any single worker from accumulating excessive dose, and the designation of control and supervised area where radiation level may vary. Regular safety training update and competency evaluation ensure that staff maintain high standard of practice. Engineering control, on the other hand, involve physical modification to the working environment. Example include ventilation system, fume hoods or laminar flow cabinet for radiopharmaceutical preparation, and shielded storage and disposal unit to manage radioactive material safety. Together, administrative and engineering control provide a systematic approach that enhance safety and reduce reliance on individual behavior alone. Continuous monitoring is critical to maintain a safe radiation environment. Survey meter used for area monitoring, enabling staff to detect unexpected radiation hotspot. Regular contamination checks that ensure surface equipment and personnel remain free of radioactive residues. Personal dosimetry serve as important feedback mechanism, allow early identification of increasing exposure trend that may require intervention or workflow modification. In addition, effective workplace safety require comprehensive emergency response plan. This include established procedure for managed spill, immediate decontamination method, isolation of affected area, and proper incident documentation. Timely and well-coordinated response to emergency help prevent minor incident from escalating into significant hazard. In summary, occupational exposure in nuclear medicine is inherent but manageable risk. By understanding the main source of exposure and consistently applying principle of the time, distance, shielding, healthcare workers can significantly reduce their radiation dose. When combined with personal protective measures, safe work practice, and strong administrative and engineering controls, this strategy creates a comprehensive radiation safety framework. Ultimately, maintaining a rigorous safety culture ensures not only the well-being of healthcare staff but also enhance the quality and reliability of nuclear medicine service.